my name is Tessa. I'm going to be your student nurse today, okay?
Okay.
I'm going to be performing your postpartum assessment. I'm going to go ahead and check your ID band to make sure I've got the right woman, okay? Kirsten Logan, 9595?
Yes.
Okay. All right, so I'm going to go ahead and start with vital signs and then listening to you, okay?
Okay.
I'm going to get your temperature under your tongue. Perfect, that looks good. I'm going to go ahead and check your pulse. Pulse and respirations look normal. I'm going to go ahead and do your blood pressure. All right, that looks normal as well. I'm going to go ahead and listen to your lungs. So for these first few, I'm going to have you take some deep breaths. I'm going to go ahead and listen to your heart. I'm going to go ahead and listen to your stomach now. All right, everything sounded good and your bowels are active, so that's good. Have you been feeling any tenderness or any hard spots or heat in your breasts?
No.
Okay, I'm going to go ahead and palpate them just to make sure, okay? And you let me know if I hurt you. We're going to go around in a circular motion. I don't feel any heat or hard spots. And none in that breast either. All right, and your nipples are dry and intact, so that's good. All right, so now I'm going to lift up your shirt and I'm going to teach you about your uterus, okay?
Mm-hmm.
All right, so we put our hand right at the pubic bone, and I'm going to go ahead and feel around for your uterus. Looks like it's about 2 finger lengths down from your umbilicus. It's nice and firm and at the midline. I'm going to go ahead and show you something. You're going to put your hand down here at the pubic bone and your other a few fingers down from your belly button. Do you feel your uterus? It's nice and firm?
Yes.
Okay, so if you happen to have some heavy bleeding or you're just uncomfortable, if you massage your uterus a couple times a day for about a minute, it'll help firm up your uterus and stop bleeding. Well, not stop bleeding, but help it slow down at least a little bit. All right, I'll cover you back up that way. Have you been having any bowel movements yet?
No.
But gas?
Yes.
Perfect. So if you haven't had a bowel movement for a while, it's good to increase your fiber and your water intake. And we possibly will offer a stool softener, so you might want to take that offer just because then it'll help you get back to normal bowel movements for when you go home. And then how about peeing? Has it been burning or itching or smelling bad when you go pee?
No.
And you've gone at least since you've had the baby?
Yes.
Perfect. I'm going to go ahead and check your pad, okay? So I'm going to go ahead and look. All right, and you changed this pad about an hour ago, correct?
Yes.
All right, so it looks like we have a moderate amount of red bright blood, which is what we call rubria. You're going to have that for a couple days after you have the baby. It's just important to note that you don't have any clots or any signs of infection. It's not hurting or anything like that, correct?
No. Yes.
All right, perfect. It looks good to me. If you do soak a pad completely within an hour, something's wrong. We gotta get you to a doctor, okay? Or if you see blood clots bigger than golf balls, that's a problem as well. So let's notify your doctor. Now I'm gonna have you roll over so I can check the site, okay? All right, where you had your epidural, it looks good. There's no signs of infection. And right around where you had the baby's looking good, where they stitched you up, we have no redness, edema, or bruising, and we don't have any discharge, and the incision site looks good and approximated, okay? So we're looking good there. If you would have had a C-section, I'd be checking for the same thing, but right around your belly, if it's red, or if we have the bruising, or if we have the edema or discharge from the site, and if it is approximated, so if the sutures are together or not. So the last step that we're going to check is your legs. I'm going to be checking for DVTs. Have you been having any soreness or pain in your calves?
No.
Perfect. I'm going to go ahead and roll up your pants. Okay, they don't look hot or red. And they don't feel hot, or at least this one doesn't. And this one doesn't feel hot, and there's no pain when I'm grabbing them?
No.
Perfect. And they look the same size. One's not bigger than the other, so that's great. All right, and you've been a joy to deal with me here, so I appreciate that. And you haven't looked sorrow or somber or anything like that, so I think I'm good on teaching about postpartum since you didn't exhibit any signs. Is there any questions for me or anything that you'd like to talk about?
No, I don't believe so.
Okay, I'm just going to touch on some things that we talked about. So you're going to check your pad. If you're soiling it more than an hour and the whole thing is soiled, you're going to call your doctor, correct?
Yes.
You know that taking a stool softener or increasing your fiber and increasing your water is good for you for your bowel movements.
Yes.
And you know how to massage your uterus now if you're bleeding quite a bit.
Yes.
Okay, and my last teaching point will be about getting up and walking around. It'll help your chances decrease of getting a blood clot, or what we call a DVT, and it will just help your overall mood. So if you have anything else you need from me, you just let me know, but I'll be around, okay?
Thank you.
All right, thank you.